African sub-region. Over the years, in terms of our global ratings, in terms of development, the West African sub-region is termed as a place of great resource. But one of the key things that affects the movement and the further development of this resource is health. And so interventions such as this, which is being coordinated and being overseen by the National Institute for Health Research, is one that must be lauded greatly. Later today as well, we will be paying special respects and honoring individuals and institutions who have applied their respective energies to this very special cause. Our gathering here, Honorable Minister, ladies and gentlemen, is the doing of the good Lord. And as tradition has always been at gatherings which are put together by the NIHR in collaboration with the Ghana College of Physicians and Surgeons, would always like to pay respects to God. Today is no different, and that's the reason why I'd like to welcome up here to the stage the Non-Communicable Disease Alliance Ghana National Coordinator, Mr. Labram Musa, to help us with a word of prayer. Shall we welcome him with a round of applause?
Good morning, Honorable, and good morning to everyone. And shall we be in a mood of prayer, please? We both pray. In the name of Allah, the Beneficent, the Merciful. Ya Allah, we come before you today and ask for your support, your guidance, and your protection as we begin this important national discourse. We ask that you help us to engage meaningfully in this national event, so that at the end of it all, we shall give you all the thanks and praises, so that eventually we'll be able to reduce the burden of non-communicable diseases in our country and also in the sub-region. This and many more, we ask you. Amin, amin, amin.
Shall we appreciate Mr. Labram Musa with another round of applause? At this time, it gives me great pleasure to welcome to the stage for our official welcome a fine gentleman who has paid his dues when it comes to public service, especially in the health sector. He is very well respected and known for his exploits as a specialist obstetrician gynecologist and reproductive health epidemiologist. He's a fellow of the West African College of Physicians and Surgeons, and also a fellow of the American College of Obstetricians and Gynecologists. He has over the years as well mentored many of our allied health professionals who have had the opportunity to take parts of their training from the Ghana College of Physicians and Surgeons, where he serves diligently as its rector. Our yet to be introduced chairperson, Honorable Minister, distinguished guests, ladies, gentlemen, our friends from the sub-region, it gives me great pleasure to welcome here Professor Richard Adanu.
Honorable Minister, President of the Ghana College of Physicians and Surgeons, Director General of the Ghana Health Service, officials from the National Institute for Health and Care Research UK, representatives of partner institutions, members of the project implementation team, invited guests, ladies and gentlemen. It's a great honor for me to be here to welcome you to this public announcement of the grant to the London School of Hygiene and Tropical Medicine and the Ghana College of Physicians and Surgeons. The Ghana College of Physicians and Surgeons is greatly honored to be a recipient of this award and having the opportunity to contribute to the prevention of non-communicable diseases in the sub-region and in partnership with other West African countries. We all know that non-communicable diseases are a very important health issue currently. And anytime I have a meeting with people like us who would be described as the, let's say, the middle class, I say that it's most likely that maybe even 80 to 90% of us will eventually leave this world due to the effects of non-communicable diseases. So if for no reason at all, for the purely selfish reasons that this is what is going to touch most of us, we should be committed to working on non-communicable diseases. Ghana College of Physicians and Surgeons is established as an agency of the Ministry of Health by the government of Ghana, and our mandate includes the postgraduate training of physicians and surgeons, and the contribution to policy, public health policy, as well as the promotion of research in medicine and surgery. And we are here today on the aspect of a mandate to promote research in important health issues and in issues relating to public health. And we are very grateful to this partnership with the UK government in being able to launch this top NCD program. And the UK government as a whole has shown great commitment to the cause of Ghana College of Physicians and Surgeons. In addition to what we'll be hearing today, this grant has been awarded through the National Institute for Health and Care Research, UK, the Foreign Commonwealth and Development Office, the FCDO, which is based in the British High Commission here, has also been working with the Ghana College of Physicians and Surgeons through the Tropical Health Education Trust to help build capacity in selected faculties of the Ghana College of Physicians and Surgeons. So through the sponsorship of the UK government, we've been able to facilitate curriculum development in 4 faculties of the Ghana College of Physicians and Surgeons, and we recently launched a platform where there are virtual lectures in collaboration with the Royal College of Pathologists. So this second grant that is coming under the auspices of the UK government is a thing that we are going to trumpet out loud, first to show our gratitude to the UK government, and also to tell other governments that if they thought they were ahead of the UK, in terms of, as far as the Ghana College of Physicians and Surgeons is concerned, the UK is way, way ahead of everybody else. So we're very grateful for that. I'd also like to take this opportunity to publicly applaud Professor Irina Jipong for her, I'll say, virtual, almost singular effort in getting this grant to come to the Ghana College of Physicians and Surgeons. I've known Irene for many years. Irene has, I tell people that Irene is more of a researcher than a public health practitioner. But then the greater part of her working life has been with the Ghana Health Service. But Irene is a researcher par excellence, and in our bid to create a vibrant research portfolio at the Ghana College of Physicians and Surgeons, Irene is probably the one who's made the greatest contribution so far. So Irene, we're very grateful that you have helped put Ghana College of Physicians and Surgeons on the map here. And for those of you who want to hear more about what Irene has done, I'm inviting you to our annual General Scientific meeting on the, I think it's the 8th of June, 8th of December. That's when we are doing the main thing. Come over and I'll tell you more about it. I've already warned Irene that I'm going to embarrass her at that meeting, and she'll be there, and we'll all hear about the great things that she and her team have done to contribute to research through the Ghana College of Physicians and Surgeons. So once more, I'd like to say a big welcome to you to this meeting. Special welcome to those who are in Ghana for the first time. And I want to state publicly that Ghana College of Physicians and Surgeons is fully committed to ensuring that the objectives laid out in this grant are achieved, and ensuring that through this grant, we would increase research capacity in Ghana, in the sub-region, and would also contribute to making many major interventions that would help prevent non-communicable diseases in the country. Welcome to this wonderful meeting. Thank you.
Once again, we're very grateful to you, Professor Richard Adanu, who is the rector of the Ghana College of Physicians and Surgeons. Shall we appreciate him with another round of applause? At this time, I would like to acknowledge the presence of our guests who are seated at the top table. And as somebody who is very used and very accustomed to the book Courtesy for Boys and Girls, I would do the ladies first rule. Honorable Minister, our yet to be introduced chairperson, it's my pleasure to acknowledge the presence of a seasoned Ghanaian chemist who is highly recognized for her work in magnetic resonance imaging and institutional policy making, currently serving as Senior Program Manager at the National Institute for Health Research. Shall we acknowledge the presence of Dr. Sylvia Ani? Professionally, he earned his degrees at the tertiary level in the finance sector and has played a very key role there. Over the years, and as hard work and aspiration has gotten it, he's written a completely different script from his original place and his first love. He's applied his energy as a seasoned public servant, has worked as a member of parliament, and has served Ghana's parliament in various capacities. Distinguished guests, ladies and gentlemen, since he was named as Health Minister of the Republic of Ghana, he's been very passionate about interventions such as what we're doing here, which is the effort to ensure that we completely eradicate non-communicable diseases. He has also been at the forefront of ensuring that our institutions are empowered through the establishment of infrastructure and major infrastructure in as many spots in the country as possible. Distinguished invited guests, ladies and gentlemen, the Minister for Health of the Republic of Ghana, Honorable Kweku Agyeman-Manu. I'll jump one spot, just like is done in a subject on the mathematical table, and go to the extreme end. And it gives me great pleasure, ladies and gentlemen, once again, to celebrate one of the finest professionals when it comes to public health in this country. He has been at the forefront of the implementation of high-impact solutions to major challenges that are always bedeviling our populace in this country. Within these 30 years, he has found himself on many stages such as this, and has also contributed greatly to the national discourse when it comes to public health. A senior public health specialist who is now serving the nation as the Director General of our health service here in Ghana. Please help me acknowledge the presence of Dr. Patrick Kuma Abuaje. To chair this occasion, ladies and gentlemen, our friends from the West African sub-region, is another consummate health professional who has made impact not only here, but in every other place where he's found himself practicing. I'd like to welcome here to the stage for his introduction, the chair of the Public Health Faculty at the Ghana College of Physicians and Surgeons, Dr. Della Dovlo. Please help me with a big round of applause.
Thank you, Mr. Ato. Honorable Minister, a pleasure to have you as always. Distinguished guests at the high table, distinguished participants, it's my pleasure to introduce the chair for this occasion. He has advised me to be as short as possible, concerning my introductions and talk about him. But just to say his name is Dr. John Nkrumah Mills, my senior colleague graduated from the University of Ghana Medical School many, many years ago. He's also a distinguished surgeon with a fellowship of the Royal College of Surgeons, of the West African College of Surgeons, and indeed, most important, of the Ghana College of Physicians and Surgeons. He's been a very practical surgeon working at the Volta River Authority Hospital for many years, but also involved in teaching and in various policy aspects of health in the country. And lately, championing the cause of the National Surgical Obstetric Anesthetic Action Plan for the country, which we've been delaying a bit, but he's a point person for that. So let me leave you with Dr. John Nkrumah Mills. One factoid, he's the only person I know who combines the name of two very favorite presidents in Ghana, President Mills and President Nkrumah. And so you can imagine how distinguished he is. Dr. Nkrumah Mills, thank you.
Thank you very much, Dala. When I realized I was born distinguished, I decided that I would die distinguished. Honorable Minister, distinguished high table, distinguished guests and partners, and yet to be partners. I'm really delighted to be here and actually excited, to be honest. As said by the rector of the Ghana College of Physicians and Surgeons, the act which brought the college, Act 833, 2011, specifically states that the third objective is postgraduate training and research in medicine, surgery, and related subjects. And the college has been doing that. Yes, we've seen some of the results. They seem okay, but we are not satisfied because we are capable of better. And then also, it's been disparate here and there. Results are coming. So now we believe in organizing properly to get the results which we believe we should be getting. I remember I was told I'm a senior colleague. Yes, there are senior colleagues. Several years ago, one of the physicians at Kolebu Teaching Hospital actually was the first to describe a situation where a very important, useful antihypertensive propranolol did not seem to work well in a family. It started with a patient. He documented it. Now, how many people are aware of it? Some people may be receiving propranolol or its analogs for hypertension control and may not be having satisfactory results. Then also a senior colleague, a surgeon, made me aware of a family that has what is called a polyposis, familial polyposis coli. Now, this is where little lumps and things grow on the inner lining of the large intestine. It just doesn't grow. These people tended to be dying off early from intestinal problems. This condition is a prelude to a cancer formation in the large bowel. It has been recorded. But are these two families the only ones in Ghana? They are both in Accra. So should I say, are they the only ones in Accra, even? This year, I was reminded of a baby, 2 weeks old. that we manage with diabetes mellitus. Is this the first in the world? I doubt it. Is it the last in the world? I doubt it. Of course, I didn't manage it. I'm not a diabetologist. So I referred the baby to Kolebu Teaching Hospital. But this is the situation. If we do not look into what is happening, we will not know what is going on. Oh yes, we are hard hit by communicable diseases. But some of the non-communicable diseases pleasurably inflicted on ourselves are also causing problems. Do we know how much of it there is? And then also, recently, had to get to Liberia for an examination of their postgraduates. And then I got a patient who was going to really have a session with the candidate. Then I asked the patient's name, and he's from Ghana. I said, hey, wait a minute. I thought these cases were happening in Ghana, but there it is in Liberia. So are these problems that we are having with non-communicable diseases only a Ghana phenomenon? Certainly not. So it makes good sense that if it is possible, we'll collaborate with our neighbors, because you may go to Liberia and get ill, so that we are managing these things well together. So my excitement is that it looks to me that we are beginning to collaborate properly, and we have good collaborators, our partners, and we are going to start a real job of defining the problems. And then when we define the problems, then we'll know what they are, and we will be able to manage them to the good of our people. Not only in Ghana, but hey, you can travel to Liberia also. Of course, we've been working with the Ghana Health Service, and ever so often you get that information. We are planning research activities for the year. We would be involved, and then we have seen the results, as I've said, and we are not satisfied. But now that we are starting, I believe when we go together, we will achieve a greater impact. And so this function, I'm really looking forward to our seeing the situation as it is, saying where we have got to, and defining our way forward, so that the results will be for the good of our people, and I can assure you it will be for the rest of the whole world also. So we'll be looking at how we're going forward and seeing how we can achieve this. Together, let's move forward, and we'll achieve it. Thank you all very much.
We're very grateful once again to Dr. Nkrumah Mills, our chairperson for today, especially for admonishing all of us to add our respective energies to the effort into bigger research into where we are, what the figures are looking like, and of course, where we will be going in terms of the efforts that's going to be put in. Distinguished ladies and gentlemen, at this time, I would like to pay respects to our friends who are joining us from the FCDO of the British High Commission here in Accra. The program manager, Mr. Richard Addo, is here with us. Please put your hands together for him. Also, the team leader for human development, the FCDO unit of the British High Commission, Enyona Mazuma, is also here with us. Please put your hands together. We also duly acknowledge the presence of Dr. Alan Ani of the UNDP. Shall we put our hands together? And also representing the UNDP here today is Belinda Amankwa. Please help me with a round of applause to acknowledge their presence here. A very key element of today's function is the NIHR Global Health Research Center Awards. That will be overseen and conducted by Dr. Sylvia Ani. Shall we put our hands together and welcome her?
Thank you very much for the warm welcome. Honorable Minister, distinguished ladies and gentlemen, we are absolutely delighted to be here this morning for this event. It has been a long journey. We first issued out the call for proposals in October 2020. And then decisions were made in April 2022. So it has been a long journey, but we are pleased to say that we are able to fund 5 NCD awards, and the coverage of these awards is truly remarkable. So I will share with you a bit about what we do at the National Institute for Health and Care Research, and then I will talk a bit about this program. So if I may have the video clip, please. If you can start it from the beginning, please, to allow for the distinguished guests to have a seat. Thank you very much, ladies and gentlemen. If I may have the next slide, please. So funding applied global health research and training. This is what we do at the NIHR. We provide funding support. Next slide, please. Now, what are the objectives for the portfolio? To address the shifting global burden of disease, to develop health systems to identify and respond to population needs, to build resilience of the health system, and also to strengthen research capacity in developing countries and in the UK. Next slide, please. Where does the funding come from for this important work? It's funded by the Department for Health and Social Care through the ODA allocation as part of the UK aid budget. And also activities for the direct and primary benefit of people in ODA eligible countries. So one of the prerequisites of our funding under this portfolio is it has to be an ODA eligible country. Next slide, please. How do we fund projects? We deliver it through a call for proposals and also through strategic partnerships. So I would like to urge those who are here to keep looking on the NIHR website. We've just done another call for negative climate effects vis-à-vis health. And that is an ongoing one. The deadline hasn't passed as yet. So the first phase of funding was from 2016 to 2021, and we funded approximately £440 million invested in research in this first phase. So what type of research programs do we have? Quite a variety. We have a program called the groups, the units, and then this one, the centers. We have HPSR, the RIGHT program, the PROFs program, and the partnerships program. What we are trying to cover is to look at, respond to the gaps in research, be strategic, be thematic, look at capacity strengthening, and it should be researcher-led. Next slide. So we come to the centers, and that is why we're here today. Why are we funding, or why have we put together a centers program? The centers program is to look at non-communicable diseases. And it's to support the growth of the low-middle income country research ecosystem. The second bullet point is very important. We are looking to shift the center of gravity from high-income country to LMIC-led research. And we want to place equal importance on capacity strengthening. So when it comes to funding research fellowships, masters, PhDs, these are essential components of the centers program. And as I said with the final bullet, we are looking at applied health research in non-communicable diseases. Next slide, please. So what is the center? When we say it is a center for non-communicable diseases, basically it consists of 5 entities. So there is the low middle income country joint lead, and then there's the UK co-lead, and then you have up to 3 co-applicant institutions. So this is what we mean by the center. LMIC lead, UK, and then up to 3 others. So what does it mean for this project that we are funding? For this project, next slide please, we have the Ghana College of Physicians as the LMIC lead. And then we have the London School of Hygiene and Tropical Medicine. So these are the institutions as the co-lead. And who are the other 3 institutions coming on board? We have Ashesi University. We've got Catholic University of West Africa in Burkina Faso. And then we have Lasdel in Niger. So when we talk about the Centers Consortium in Ghana, in West Africa, this is the team who will be working together. And each institution will be led by a director. Next slide, please. So, ladies and gentlemen, this is just to give you a brief on what the Centers program is about. And as we go through the day, there will be more information that we will share. The funding is approximately £10 million over 5 years. So it is significant funding, and we want to do well. Out of the 5 awards that we are providing, this is the only one that looks at research in West Africa. And I am very pleased as well to say that for processes like this, you need very rigorous reviews of proposals. When we put the call out, we had about 40 applications. So we immediately had to set up a team of experts who could advise us and who could look at the direction of travel. And I'm very honored that 3 of them are here with us today, and they will be giving remarks as well. May I introduce the first one? All right, so Professor Eugene is from Yaoundé University, Cameroon, and he was one of the experts who gave very invaluable advice to the NIHR. And Prof, if you could stand for a round of applause. And then we also have Professor Dr. Benedict Wibong. I hope you're here. University of Ghana, Public Health. He's not here at the moment. What about Professor Owusu Dabo, Kwame Nkrumah University, Pro Vice Chancellor, not here yet. So these people really helped us to shape our ideas, and I will pass on to Professor Eugene for some comments, please.
So I guess I have the time that was allocated to all my colleagues for me alone. Ladies and gentlemen, all protocol duly respected, I would like first of all to say thank you for this invitation on this very special occasion. I think I will continue in French, or it will be a mix of French and English, just to celebrate one of the reasons why we are here. Is really the success of partnership, the success of cross-border excellence. Oui, je voudrais dire merci pour l'honneur qui m'est fait de me demander de dire quelques mots d'introduction en cette occasion particulière. Cette occasion unique. Yes, it is unique because we are clearly facing a unique situation with multiple burden of disease, with multi-morbidity, with the world experiencing both communicable and non-communicable diseases surge, with Africa being like a laboratory where what we call epidemiological transition is one of the most rapid in the world history. And because these diseases do not know borders barrier, do not know specialty barrier, do not know cultural barrier, the response should be cross-continental, should be cross-country, should be cross-cultural, should be cross-disciplinary. Le consortium Stop NCD, ce centre de recherche en santé publique globale pour la lutte contre les maladies non transmissibles, aujourd'hui financé par le NIHR UK, est donc une des réponses les plus appropriées à ce problème du fardeau de la maladie qui ne connaît point les frontières géographiques, qui ne connaît point les frontières culturelles, qui ne connaît point les frontières disciplinaires. Oui, nous voulons dire merci au NIHR UK parce qu'il a été possible de prendre en compte cette situation bien particulière où, malgré le fardeau de la maladie croissant, l'Afrique fait face également à une insuffisance des financements de la recherche. Et je dirais même pire, l'Afrique francophone, encore plus que le reste de l'Afrique, n'a pas l'habitude, je dirais, de capitaliser sur des financements de la recherche. Le consortium dont il est question aujourd'hui a le mérite de franchir les continents avec des investigateurs de Grande-Bretagne et d'Afrique, de franchir les frontières avec de nombreux pays, de franchir l'héritage culturel avec les francophones et les anglophones au sein d'un même consortium, de franchir la barrière des disciplines avec les sciences dites soft science et hard science à l'intérieur du même consortium, mais surtout de promettre la croissance avec les ingrédients pour la croissance de nos meilleures graines sur le continent. Oui, ce consortium est clairement la promesse de l'excellence scientifique, l'engagement du partenariat, l'espérance du succès partagé. Oui, parce que c'est ensemble que nous allons le faire, c'est ensemble que nous sommes plus forts. I would just like to conclude on this in English. It's together we are stronger, and this partnership is the clear demonstration, but it's also a challenge for all the partners here to be the success we wish them to be in order to make sure the funders will really be enthusiastic in funding other initiatives, other cross-border initiatives, other cross-cultural initiatives. Thank you very much.
Thank you so much, Professor, for your remarks. And on behalf of the National Institute for Health Research, we would also like to say thank you for the guidance you gave us throughout this journey. May I ask if Dr. Benedict is here as yet? Not yet. All right, then. Nathaniel, over to you. Should they go back and sit?
Yes, I guess. Thank you. Once again, we're very grateful to you, Dr. Sylvia Ani, who's the Senior Program Manager at the NIHR UK. At this time, ladies and gentlemen, I'd like to welcome here to the stage our friends who will be giving us an overview of the NIHR, beg your pardon, Global Health Research Center West Africa proposal. Before that, however, I'd like to urge all of you to get on your social media platforms and share all the positive news from here. It's with hashtags StopNCD and hashtag StopNCD Once again, it's hashtag StopNCD and hashtag NCD West Africa. Also, you can reach various platforms and accounts on Twitter, Facebook, and YouTube, and it's at Ghana College of Physicians and Surgeons. Honorable Minister, distinguished guests, ladies and gentlemen, I'd like to welcome here to the stage Professor Tolib Merzoev and also Irina Japon to help us with some further insights into this proposal. Shall we welcome them with a big round of applause?
Yeah.
Mr. Chairman, Honorable Minister,
it's not working. Okay. Mr. Chairman, Honorable Minister, distinguished guests, ladies and gentlemen, jointly with my co-director, Professor Tolib Merzoev from the London School, will present our proposal. Next slide, please. Our center responds to an urgent need for enhancing research capacity to inform effective evidence-based and people-centered approaches to NCD control in West Africa. Next, please. Okay. We will work in Burkina Faso, Ghana, and Niger to ensure sharing and learning across Anglophone and Francophone contexts in West Africa. Our proposal responds to high demand from policymakers, civil society organizations, and communities, building on our strong policy links and stakeholder mapping conducted during proposal development. Next, please. Our goal is to contribute to improved health in West Africa through improving capacity for applied research to improve prevention, diagnosis, and management of 3 connected non-communicable diseases: hypertension, diabetes, and common mental health disorders such as anxiety, depression, stress that are associated with chronic illness. We want to leave a legacy of person-centered, integrated, and system-wide responses to NCDs at community and primary care levels through African-led research by high-quality scholars embedded within supportive organizations, networks, and policy environments, all within Africa, and all contributing to reduced mortality from non-communicable diseases, improved health, and well-being. Next slide, please. Our research themes reflect 3 interrelated levels of support for non-communicable diseases. Number 1 is individual and community. Number 2 is facility. And number 3 is policy and systems. These will intersect 3 phases shown as work packages 1 to 3. Phase 1, which will be the first year of this work, will deepen our knowledge of country context and synthesize and contextualize available evidence. So this will be the focus of our work in the first year, which starts from 1st October 2022 through to 30th September 2023. In phase 2, which is year 2 of our effort, we will work closely with key stakeholders, drawing on the evidence we have generated in year 1 to co-produce content-specific intervention packages covering community-based prevention and facility-based care. In phase 3, which is year 3 to 5 of the project, we will now pilot test, implement, and evaluate the interventions which we have generated together in phase 1 and 2. Pilot testing will involve formative evaluation using mixed methods and summative evaluation. Examples of outcome measures that we are going to be interested in are treatment, utilization, access, adherence, access to prescribed medication, blood pressure, and blood sugar monitoring and control. We also have cross-cutting work packages, as you heard in Dr. Annie's presentation. This is not only about generating evidence from research, it's also about capacity strengthening. So we have a knowledge exchange and research uptake and use. So we have cross-cutting packages dedicated to capacity strengthening, knowledge exchange and research uptake, community engagement and involvement, monitoring, evaluation and learning, governance and management. Next slide, and I'll hand over to my colleague.
Thank you very much, Professor Jupong. Dear Chairman, Honorable Minister and distinguished guests, our governance approach is actually underpinned by principles of equitable partnerships with inclusive and distributed leadership, cross-partner learning, and mainstream capacity strengthening. The Executive Committee, or EC as we call it, will be our main decision-making body. It will comprise all applicants, work package and theme leads, and for all the daily activities it will be supported by the project management office, which is a bilingual structure that will be equitably shared between GCPS and LSHTM. And we'll also have 3 advisory structures. An independent committee, scientific committee, will provide scientific advice, and in-country multi-stakeholder groups will review feasibility of our research plans, and together with regional and international policymakers will facilitate research uptake into policy and practice. Next slide, please. Our consortium has the following strengths. So first is over 10 years of collaboration between the lead applicants, including ongoing MRC-funded research on adolescents' mental and sexual and reproductive health, as well as research on health systems responsiveness. Next, please. So we have a genuinely equitable partnerships with shared governance and distributed leadership roles within the consortium. Next, please. We have successful leadership of similar complex programs and networks utilizing robust organizational governance structures and processes that we'll build on. So we have strong partnerships with policymakers such as ministries of health in all countries, national NCD programs, and civil society organizations such as Global NCD Alliance branches in Ghana and Niger, as well as various civil society organizations in Burkina Faso. Next, please. So we have comprehensive capacity strengthening that will involve mutual learning and sharing across Anglophone and Francophone contexts, with particular emphasis on developing the earlier career staff and earlier career professionals. And last but not least, we are a truly gender-balanced consortium with strong complementarity between the clinical, public health, health systems, and policy expertise. So we're really proud of where we got up to and very much looking forward to working on this exciting topic. Thank you very much for your attention.
We're very grateful to you. Ladies and gentlemen, shall we do another big round of applause? While we go through the day, I would once again like to encourage all of you to spread the good word especially as we know that we're getting into periods of very intensive research to ensure that non-communicable diseases become a thing of the past and are able to fizzle into thin air practically. Honorable Minister, our chairperson, distinguished guests, ladies and gentlemen. Neighboring Burkina Faso are a key ally in the execution of this project. And the representatives of the Minister of Health of Burkina Faso are here with us to share their message and their perspective as well. Please help me with a big round of applause to welcome Dr. Siri Bapaman Abdelaziz and also Mr. Sabo Hassan Adamu of Niger as well. Please welcome them with a big round of applause.
Ok, bonjour, merci tout le monde. Excellence, Monsieur le ministre de la Santé, distingués invités en vos rangs, grades et distinctions respectives. Nous voulons tout d'abord vous remercier de nous avoir associés à ce lancement. C'est un grand honneur pour nous de pouvoir participer à cette annonce publique de l'initiative. Donc, la situation des maladies non transmissibles est une réalité chez nous, au Burkina, comme dans la plupart des pays en développement où elle se pose avec beaucoup plus d'acuité. Pour nous, c'est en tout cas, cette initiative est la bienvenue pour asseoir une bonne collaboration dans une perspective multisectorielle et pouvoir tester, appliquer des stratégies qui vont permettre en tout cas d'inverser la situation des maladies non transmissibles dans la sous-région en particulier. La contribution de la recherche est en tout cas plus que déterminante. Je m'en vais peut-être faire juste un petit aperçu sur la situation de certaines maladies non transmissibles au Burkina Faso. Donc, j'ai choisi de parler des maladies cardiovasculaires. Donc, je ne vais pas prendre du temps, c'est juste donner un aperçu. OK, diapo. Diapo encore. Voilà. Donc, ça, c'est un aperçu sur les facteurs de risque comportementaux que nous avons réalisés et on a comparé sur 2 périodes, entre la période 2013 et 2021. Voilà, et ces facteurs de risque comportementaux, on peut bien voir que dans la plupart des cas, ces facteurs, soit ils sont stables ou ils sont en croissance, voilà, en évolution pour ce qui est de la prévalence. Diapo. Voilà, donc ici, on voit que dernièrement, pour l'obésité, par exemple, on a un accroissement en 2013 et puis 2021. Diapo. Diapo encore, je ne vais pas m'attarder sur ces éléments. Voilà, ça c'est un peu pour montrer la capacité du système à diagnostiquer et à traiter ces quelques maladies cardiovasculaires. Donc ici, c'est le diabète de type 2 et les maladies cardiovasculaires. Donc vous pouvez en tout cas constater qu'il y a des gaps en termes de capacité, la capacité des ressources humaines à diagnostiquer correctement, la disponibilité des directives, également la disponibilité des produits, des médicaments, je vais dire. Donc ça, c'est un gros challenge pour nous. Diapo. Ça illustre, ça c'est une cascade de soins que nous avons réalisés pour montrer un peu les gaps en matière d'accès en matière de couverture, d'accès aux soins préventifs et curatifs. Donc, on peut voir que sur cet échantillon que nous avons à partir de l'enquête STEP de 2013, on voit que sur près de 1500, un échantillon de 4500, à la fin, on voit qu'il y a moins de 10%, qui ont leur hypertension contrôlée. Donc, on voit des gaps à plusieurs niveaux, non seulement au niveau de l'information, au niveau de l'accès au traitement, au niveau du contrôle. Donc, ça, c'est pour montrer un peu les gaps. En termes de réponse du système de santé, diapo. Voilà, donc le Burkina a élaboré 2 plans stratégiques. Le premier en 2014, qu'il a adapté en 2016. Voilà, et il y a quelques opportunités en termes de réglementation, parce qu'on a certaines politiques, certaines directives qui peuvent aider à lutter un peu contre les maladies non transmissibles. Encore faut-il que ce soit relu, adapté et suivi effectivement sur le terrain. Diapo. Voilà, donc le système d'information également embryonnaire, il prend en compte quelques maladies non transmissibles. Voilà, donc il y a aussi une nécessité de revoir et d'adapter ce système d'information. Diapo. Voilà, donc en résumé, pour dire que la charge est élevée, et ce n'est qu'une partie que nous avons, que nous voyons. Il y a nécessité en tout cas de mieux zoomer, de bien comprendre pourquoi, comment on peut mieux adresser ces maladies non transmissibles. Et pour cela, il faut en tout cas qu'on puisse pouvoir renforcer, voir quelle stratégie pour renforcer la gouvernance dans une approche multisectorielle, comment mieux utiliser nos données, utiliser d'autres approches pour pouvoir venir à bout de ces maladies qui sont en augmentation, et chez nous, nous sommes encore challengés parce que nous sommes dans un contexte de sécurité précaire où nous avons 3 millions de déplacés internes. Donc, comment on va faire en tout cas le lien, pouvoir juguler les autres maladies et pouvoir adresser ces questions-là également chez ces déplacés internes, chez qui on sait qu'ils sont également à risque de ces maladies. Donc, sur ce, c'était ce que j'avais à partager un peu sur le Burkina, brièvement, et je vous remercie pour votre attention. Merci.
Merci, Monsieur le Président. Alors, moi, je m'en vais délivrer un discours succinct pour ce qui concerne le volet technique. Donc, je suis avec la représentante du coordinateur national de lutte contre les maladies non transmissibles. Ça, nous le verrons après. Monsieur le Président, Excellences, Monsieur le ministre de la Santé publique du Ghana, honorable recteur du Collège ghanéen des médecins et chirurgiens, Mesdames et Messieurs les représentants des organisations et institutions internationales, Mesdames et Messieurs les organisateurs de cette auguste assemblée, Mesdames et Messieurs les participants, Mesdames et Messieurs les invités, à vos titres, grades et qualités, tout protocole respecté. Je voudrais, au nom des plus hautes autorités du Niger, vous remercier très sincèrement de cette initiative opportune à la cérémonie qui consacre le lancement de l'initiative Centre de recherche en santé mondiale en Afrique de l'Ouest. Votre présence effective à cette rencontre témoigne en un point douté de votre engagement individuel et collectif à promouvoir la recherche en santé dans l'espace CEDEAO, contribuant ainsi à la lutte contre les maladies non transmissibles pour le bien-être de nos populations de plus en plus éprouvées par ce fléau du XXIe siècle. Mesdames et messieurs, les principales maladies non transmissibles que sont les maladies cardiovasculaires, les cancers, les maladies respiratoires chroniques et le diabète constituent de nos jours un problème majeur de santé publique à l'échelle mondiale et plus particulièrement dans les pays à revenus faibles et intermédiaires comme ceux de notre espace commun. En effet, l'Organisation mondiale de la santé estime depuis 2018 que plus de 71% des décès environ qui surviennent chaque année au plan mondial sont dus aux maladies non transmissibles. Ce fléau impose au monde un triple défi, à la fois sanitaire, social et économique. Pourtant, ces maladies partagent en commun des facteurs de risque bien connus et modifiables. Au Niger, selon les résultats de l'enquête STEPS réalisée en 2021, chez les adultes âgés de 18 à 69 ans, la prévalence des facteurs de risque de MNT est soit en augmentation, soit à un niveau élevé par rapport à l'objectif d'élimination par les instances internationales et nationales. En effet, selon les résultats de cette étude, plus d'une personne sur 4 avait une pression artérielle élevée et que 87,7% d'entre eux l'ignoraient. 2,3% des adultes avaient une glycémie élevée et que 95% l'ignoraient. Plus de 4 sujets sur 5 consommaient moins de 5 portions de fruits et légumes par jour. 22,6% des adultes consommaient des plats riches en sel. 6,2% des sujets consommaient du tabac. 49,6% ne pratiquaient aucune activité physique intense. Environ un sujet sur 10 était en surpoids et environ un sujet sur 20 était obèse. Notons aussi que 94,2% avaient au moins un facteur de risque de maladie non transmissible. Mesdames et messieurs, pour riposter à la prévalence et à la mortalité de plus en plus élevée liée au MNT, le Niger a mis en place, dans le domaine public, au plan institutionnel, le Programme national de lutte contre les maladies non transmissibles, le Centre national de lutte contre le cancer, 3 laboratoires d'anatomopathologie, 2 hôpitaux généraux de référence, 3 hôpitaux nationaux, 8 centres hospitaliers régionaux, 8 centres de santé de la mère et de l'enfant, 72 districts sanitaires et un réseau d'environ 1266 centres de santé intégrés. Au plan politique et stratégique, la politique nationale de santé 2015-2035, le plan de développement sanitaire et social 2022-2026, le plan stratégique national multisectoriel MNT 2019-2021 en cours de renouvellement, le comité national multisectoriel de lutte contre les maladies non transmissibles. Au plan opérationnel, le renforcement des capacités des agents, des acteurs et des médias communautaires, le renforcement du système de santé à travers l'équipement et l'achat des réactifs pour le diagnostic des maladies non transmissibles l'information, l'éducation et le plaidoyer à l'endroit du public, leaders et des partenaires techniques et financiers, la mise en œuvre du WUPEN et du EARTH au niveau des soins de santé primaires, le suivi et l'évaluation des interventions, la surveillance des maladies non transmissibles à travers la plateforme DHIS2, la tenue des réunions du Comité national multisectoriel de lutte contre les maladies non transmissibles. Au plan de la recherche a été réalisée l'enquête STEPS. Mesdames et messieurs, en dépit des multiples efforts déployés par notre pays pour lutter contre les maladies non transmissibles, d'innombrables défis restent à relever. Il s'agit, entre autres, de la mobilisation des ressources de l'État et des partenaires, le renforcement de la multisectorialité dans la lutte contre les MNT, la dotation des structures sanitaires en médicaments et autres technologies pour lutter contre les maladies non transmissibles, la réalisation des activités de recherche, particulièrement la régularité de l'enquête STEP et des enquêtes sur la mortalité spécifique due aux maladies non transmissibles. Les préoccupations de cette réunion de lancement de l'initiative NIR pour le développement des activités de recherche au profit de la lutte contre les maladies non transmissibles cadrent bien avec les préoccupations des plus hautes autorités du Niger, qui font de l'amélioration de la santé et du bien-être de la population nigérienne une de ses priorités. Avant de clore mon propos, je formule au nom du Niger les vœux que cette réunion d'Accra, consacrée au lancement de l'initiative NIHR, serve de tremplin au développement des activités de recherche et au-delà à plus de succès dans la lutte contre les maladies non transmissibles dans l'espace CEDEAO. Je vous remercie de votre aimable attention.
Merci, Dr. Siri Bapeman Abdelaziz and Monsieur Sabo Hassan Adamo. Ladies and gentlemen, would like to once again say a very big thank you to Dr. Siri Bapeman Abdelaziz from Burkina Faso and Mr. Sabo Hassan Adamo of Niger, bringing us their perspectives and the realities on the ground, as well as what is being done so far to help in this cause and running this very big battle. Distinguished ladies and gentlemen, policy direction here in Ghana is very key in the implementation of a project as big as this one. And the man in charge of policy formulation and implementation in the health sector himself is here because he believes very much in the ideals. With a big round of applause, please help me welcome the Honorable Minister for Health of the Republic of Ghana, Honorable Kweku Ajima Menu, for his keynote address.
Distinguished Chairman, Dr. Nkrumah Mills, the President of the Ghana College, our colleagues who are representing ministers from Burkina and Niger, the professors who have assembled here as partners for the college from various universities and institutions in our country, Director General for Ghana Health Service, who has just left us for another program, friends from academia and research institutions, development partners, and multilateral associations, institutions that are represented here. Let me first of all express my pleasure and indeed an honor to deliver this keynote address on this public announcement of the Stop NCD Award. I am reliably informed that this high-level research on non-communicable diseases is receiving funding support from the government and people of the United Kingdom. And this is being co-led by the London School of Hygiene and Tropical Medicine and the Ghana College of Physicians and Surgeons. We have a team that comprises of a cluster of research and 3 academic institutions in West Africa: the Catholic University of West Africa in Bobo, Julaso, Lasdel in Niamey, Niger, Ashesi University in Brekusu, Ghana, the college, and the UK London School for Health and Tropical Medicine. I must say that the timing is apt because the prevalence of non-communicable diseases is increasing globally and is currently the leading cause of death and disease burden worldwide, including our sub-region. We just had a conversation on NCDs at the just ended United Nations General Assembly meeting. According to the World Health Organization, heart diseases, strokes, cancers, diabetes, and respiratory diseases now outnumber infectious diseases as the top killers globally, accounting for about 74% of all deaths. These conditions are mostly due to modifiable risk factors, which include tobacco use, unhealthy diet, physical inactivity, harmful use of alcohol and other substances, air pollution, and others. Unfortunately, our disease control structures in West Africa priorities have been traditionally driven by the burden of communicable diseases. Dr. Chair, despite an increasing trend in NCD-related morbidity and mortality, implementation of global interventions such as WHO policy recommendation remains very slow. For example, Africa was off track in achieving the WHO recommendations for tackling NCD's targets for the 2015 and 2016 deadlines. It appears that despite the initial achievements by African countries towards fulfilling the commitments in the 2011 UN Political Declaration and the 2014 outcome, Africa's commitment to implementing the NCD policy responses has waned. There is no doubt that the region has been slowly responding to the increasing NCD burden, and most interventions address individual diseases rather than focusing holistically on people. A certain World Bank report indicated that unless urgent action is taken, the rising NCD's burden will add great pressure to the already overstretched health systems and pose a major challenge to development in the sub-region. Dr. Chair, ladies and gentlemen, there are clear indications that a scientific approach by the sub-region is required to improve the health and well-being of the population in West Africa that seeks to strengthen individual skills and expertise, organizational systems and processes, and system-wide networking capabilities and leadership of researchers to conduct high-quality research, local communities, to engage with and understand how to enable health lifestyles, and policymakers and practitioners to implement evidence-based NCD interventions. Again, to engage with key stakeholders, patients, health workers, managers, for consulting on their views, preferences, and expectations, sharing results as they emerge, and facilitating the uptake of research results into their decisions and practice. maintain equitable international partnerships through shared leadership involving both senior and early career staff, and equally distributed management responsibilities. For the Chair, ladies and gentlemen, these approaches will go a long way to support the realization of the Global NCD Compact and the 2022 UN General Assembly Resolution on NCDs. In Ghana, the Ministry of Health, with the support of its agencies and stakeholders, in March 2022, this year, launched the National Policy for Non-Communicable Disease, with a goal to ensure that the burden of NCDs is reduced to the barest minimum to render it of little or no public health importance and an obstacle to socio-economic development. This is aligned with the ideals of the National Policy 2020 and the Universal Health Coverage Roadmap 2020 to 2030, which calls for the use of multi-sectoral collaboration as a mechanism for addressing in a comprehensive manner all the social determinants of health for better health outcomes for all. Consequently, the development of the comprehensive policy framework on NCDs has received a very high political commitment. There is the need, therefore, to work collectively across sessions within the frameworks of health in all policies and to tackle this health and developmental challenge confronting us as a country. I wish to further express my gratitude to the funders, the government, and the people of the United Kingdom through the Department of Health and Social Care, as well as the National Institute of Health and Research, for agreeing to support the research proposal submitted with an amount of £10 million over the next 5 years. Let me also congratulate and thank one particular person, especially Professor Ajipon, who led this crusade with her team and partners to get us this far. When I was being introduced, somebody said, from a finance background, who has now become a student of medicine, and I continue learning. The one thing that intrigues me is my enthusiasm for people to do research in our country. The only challenge has been funding, and I'm very, very grateful and thankful to the government of UK and its people for supporting us. I get information about the prevalence of diabetes in the 3 northern regions in our country. And I keep on asking my directors, what are the causes? Why only the 3 northern regions? The burden is across the country, but it's more endemic up there than down south. And for the past 3 or 4 years that I've been crying for something to be done for us to find out and see how we can resolve the matter, I've got nowhere. Despite the government's efforts to try to put some emphasis on herbal medication, there are only 2 things that we can do from Noguchi, FDA, right, toxicity, and the other aspect of it with bacteriology and things like that. Then I keep on asking, what about efficacy? Can't we do trials in our country? Where are our scientists? I formed a committee during COVID. We got about 12 concoctions from different people in the country, herbal medications. Then I said to myself, who will test for efficacy? Meanwhile, we are doing malaria vaccine trials in our country. We have been doing vaccine for COVID trials in our country. But where are our scientists to initiate something domestic, traditional, for us to also move forward? The only response I get is that the teams are there, skills are there, academia is there, but funding seems to be a problem for us when it comes to research in our country. Government is doing all it can to create a research fund, only that we haven't succeeded in completing the exercise. We need to go through cabinet approvals, legislation, through parliament, before we can get budgetary allocations for this. And it's taking us some time. The president is committed to try to see how we can set up the research fund in our country, to allow that research fund to work on the model of what NIHR is doing, to see how best we can do calls, evaluate them, and award for people to do research in our country. In conclusion, I wish all the best and will be anxiously waiting for the findings of this all-important collaborative research work. I therefore wish you success as we work towards the achievement of the objectives of this laudable project. Je vous remercie pour votre attention.
We're very grateful to you, Honorable Minister of Health, Mr. Kweku Agyeman-Manu, for the encouragement and the show of commitment on the part of government to collaborate greatly with the NIHR, and also the pronouncement that government is ready and willing to work with the findings of the research that will be conducted into these areas. Honorable Minister, we're grateful to you once again. Ladies and gentlemen, shall we do a big round of applause for him? I'd also like to pay my respects and acknowledge the presence of Dr. Benedict Wubeng, who represents the Public Health Unit of the University of Ghana. Shall we put our hands together for him? Distinguished ladies? Okay. So before we speak, or before our chairperson gives us his closing remarks, I'd like to respectfully welcome up here Professor Benedict Wubeng to help us with his few remarks as we draw to a close. Shall we welcome him with a big round of applause?
Use this? Oh, thank you very much. Good morning, Honorable Minister. My sincere apologies. I think I just stepped out of the washroom when my name was called, so my apologies for that. All protocol observed. Good morning to everyone. I must say, with so much excitement, my first comments actually go to Dr. Eni for the opportunity that she gave to some of us to be able to contribute to the NIHR processes for leading to this, what we're doing today. And I thoroughly enjoyed the processes. I learned a lot, and I was able to contribute my quota to making a very strong case why we should have a program like this here in Ghana and the West Africa sub-region. So thank you very much for the opportunity. As a global mental health epidemiologist myself, I was really excited about the program that Professor Japong and a colleague are leading, and particularly excited that the role of mental health is going to be contributed and featured in this whole program. I mean, as I was sitting and listening, I realized that there was not so much talk about mental health, and that's something that is so very important. And I'm really looking forward that the program would build lots of capacity, and we are always ready at the School of Public Health to support this course. So thank you very much, and all the best. Thank you.
Tons of gratitude to you, Dr. Benedict Wubeng. Distinguished ladies and gentlemen, at this time I would like to welcome back here our chairperson for today for his concluding remarks. With a big round of applause, please help me welcome Dr. Nkrumah Mills.
Thank you very much. The hard work is beginning. Yes, as the Honorable Minister for Health outlined, we have seen the problem. We have tried doing things. And clearly, we seem to have been addressing disease issues instead of getting with the people to get the people to see and then to move forward doing what we need to be doing, as some of the risks are modifiable. And this is what has come up clearly. And what it means is that it should be possible for us to manage these NCDs. Then also, the NHIR has come up to show that with the collaboration, because part of our problem had been funding and also really getting a good protocol going. We will have to be able this time to work at it so that it's going to be a self-generating program, as it were, so that we are going to build the capacity of those who are involved in managing the NCDs, in the sense that we are not only going to treat disease issues, but getting the people to manage the situation. Then, with the collaboration, we see a clear pattern of documentation coming up, of auditing work being done, of governance, such as that we will not be accused of throwing money at problems, but putting money out to identify solutions and being accountable for it. Interestingly, both Ghana and our two neighbors seem to have the same situation on hand, seem to have also made some contribution trying to improve it. So together, we will be able to do it. And I think I want to thank the NIHR particularly for their actions on behalf of the British government and people. And our thanks will also go to the co-directors for the leadership they have provided so far, and we see hope. One of the people that have to be thanked is Maku Obobi, who's also with us. The leadership in all this, including the various recipient organizations that are going to work, also must be thanked because of the work they've put in and the hope they inspire in us. There's going to be improved review and auditing of the results. And so these are going to be put to use. These are going to be deployed in the fields where it matters. Now, the fact that it's going to build our research capacity will mean that we will be able to do research on other issues that are bothering us so as to improve the healthcare generally. It's not going to be limited to hypertension, diabetes, and mental health issues. And I must admit that we normally will not be talking too much about mental health, but it is something extremely important right now when there's so much stress and further stress we see to be coming our way, so as to be able to level-headedly live. Now, with this, I'd want to thank you all for coming in, for your thoughts, and for the plans I know you have made, and for the partnership, the collaboration that is coming up. And I think that is what we need for now. I thank you all very much. Thank you.
Dr. Chairperson, we're very grateful to you. Key within these final remarks, the fact that Ghana will be further empowered in this sector to conduct more research and research into other areas or other challenges that are affecting the sector. Honorable Minister, distinguished guests, ladies, gentlemen, our friends from the sub-region, would like to say a very big thank you to all of you for being here with us today. Over here, as tradition has always had it, we have a way of saying symbolic thank yous to everybody who is part of history-making events such as these. I'd like to welcome here Ms. Grace Aye to help us to say thank you to all of you. Please welcome her with a round of applause.
Mr. Chairman, Dr. Nkrumah Mills, Honorable Minister Kweku Agyeman-Menu, the representatives of the Ministries of Health for Niger and Burkina Faso, the representative of the British High Commissioner, esteemed partner countries and organizations, our valued researchers, distinguished guests, ladies and gentlemen, good morning. It's my privilege to have been asked to propose a vote of thanks on this very important event. On behalf of the organizers, I first of all want to thank God for making this day possible. I extend a very hearty vote of thanks to all speakers and participants for gracing this occasion. A big thank you to the Honorable Minister of Health for Ghana, Niger, and Burkina Faso for demonstrating their support and commitment towards the suppression of NCDs in West Africa. Thank you to the leadership of IASP, Lasdel, Ashesi University, who are joining us on this journey towards a West Africa with a very low rate or a zero rate of NCD-related deaths. We know that an event like this does not happen overnight, so we would also like to thank the organizing team for all the efforts invested towards the success of this event. Finally, we thank Mr. Nathaniel Atto, our MC for today, the media houses represented here, the technicians, the security teams, the media team, the interpreters, and the management of Alisa Hotel for a marvelous job done. Mr. Chairman, ladies and gentlemen, once again, I want to state that we are most grateful to everyone seated here today. We hope for a successful and productive 5 years on this project. Thank you very much. Merci beaucoup. Medasi.
And we're also very grateful to you, Ms. Grace Aye, for thanking all of us. Honorable Minister, Dr. Chairperson, esteemed guests, ladies, gentlemen, we started off with a prayer, and it's just right that we wrap it all up with a prayer in saying thank you to the Most High God for granting us the mercy to go through today's event. I'd like to welcome here to the microphone Dr. Ife Kome, who's the National NCD Control Program Manager. Thank you.
Thank you very much. Shall we pray? Father, Lord, we are most grateful for the opportunity to gather here. We are indeed grateful for the insights that have been provided for us in line with NCDs. We pray asking for guidance, not just for these 5 years, but even beyond that, the 5 years, that as a continent, we'll be able to get a grip on NCDs and even present ourselves as an example to the rest of the world as to what is feasible in terms of charting a course for the prevention and control of NCDs. We pray for your grace to carry out these actions over the course of these years, and we pray that together we'll be able to make headway and reduce the burden of NCDs as we are faced as a continent, and even for us specifically as Ghana. This, amongst other things, we ask through Christ our Lord. Amen.
Thank you very much. Ladies and gentlemen, we will have a group photograph, and that will include the sector minister and all project implementers. So respectfully, we would like to have the representatives of the health ministries of Burkina Faso and Niger. I think they'll let them advance. Yes. So in here, right in here. Outside is better? Outside. Okay. All right. Because of the banner. Okay. So would like to have the project implementers and our representatives from Niger and Burkina Faso join the Honorable Minister for a photograph. We're grateful to all of you and would like to say a very big thank you to the Honorable Minister for his presence here and his contributions as well. To all of our media partners and our friends, please do note that Professor Irene Ejepong will be granting interviews in English and Twi. And there will be a brief media session with all the media house and partner institutions, and that will be conducted by Professor Irene Ejepong, Professor Tulib Merzwev, and also Professor Angela Owusu-Ansah, and Dr. Aissa Diarra, and Dr. Maurice Yaogo. Thank you all very much. So we're grateful to all of you for being here today. My name is Nathaniel Atto. It's been wonderful sharing your company, and do have a safe trip back, especially to all of our friends who are joining us from various distances within the sub-region. Have a productive day. Thank you very much.